I wanted to do something that helped people. So because when I look at all my previous roles, they were all around that same premise of wanting to help people. I had earlier jobs within care sector, so I was working with children with special needs for an organisation called Quarriers in a respite care home. I worked in a gym, which doesn't sound like it helps people, but actually the idea was I was a fitness instructor, so I was helping people to achieve their health and fitness goals. And then from that, I then moved into being in the army for 9.5 years. But again, the idea was I joined the army because I wanted to help. And then when I left the army, I joined further education and worked in colleges to help people with their education, and then subsequently came into the NHS after that. So whilst it's not necessarily I wanted to do those specific jobs, I just knew I wanted to help and be able to help people. My degree was actually a lot more long-winded than most folk probably. I studied an NC, which I think is now an NQ, in sport and recreation when I left school initially, and then left education to work full-time. And then it wasn't until 2018 that I actually graduated with a Bachelor of Science Honours degree in sports fitness and coaching. Again, my real interest is around health and fitness and sports as well. I enjoy coaching at triathlon and swimming as well. So it's some of the things that I really like to do. I thought if I could find a degree that incorporates that I could go down that path. And yeah, so I did that, and I did that through the Open University whilst working full time. And also halfway through that study period, my daughter was born as well. I had 3 years of studying with a newborn and working full time. So quite an interesting time, but enjoyable all the same. It's almost like a natural progression. I wasn't aware that this job actually existed within the NHS before I came into the NHS, which sounds really bizarre. I was working with colleges, I was doing sports lecturing, and I was teaching swimming as well at the same time. And I needed a job that was going to be full time, and I was interested in a health remit. And it was actually my wife that discovered the advert with Healthy Valleys, one of the organisations we work with, had advertised. They were what we call hosting a post for Lanarkshire Weight Management Services. So when I looked into it, it was the Healthy Schools Partnership Officer role. And I thought, this is great. I've worked with schools over my previous jobs, enjoyed the education element of it, and it was bringing health information to the schools and helping them with the health and wellbeing within the curriculum. I applied for the job, thankfully got the job, and then when I came in, it was like, this is actually part of the NHS, it's not Healthy Valleys. I was like, oh, this is interesting. And it's hosted through Health Improvement. And I thought, oh, this is new to me. I wasn't aware of this. And then through speaking with colleagues in Health Improvement, I found out how much that is out there for us to actually sort of step in and out of. And then this position came up. I'm a Health Improvement Senior for one of the localities. Our localities are Wishaw and Shotts. And when it came up, I applied for the role. And thankfully I got the job, which was great. And that then gave me that permanent role within the NHS. But initially, I just didn't have an idea that this was something that you could do. And I now know that this is something I can do. So I've actually, all my further education as well has been geared towards improving my knowledge in the area. So I've just started a Masters in Public Health as well as a result of being within this role. I like to say it's almost like you're trying to put doctors out of work. So the idea of health improvement is to stop people from ever needing to go to the doctors and things. But obviously, I mean, it's quite almost like a flippant way of looking at it. But ultimately, we're looking at reducing health inequalities. So those that are from poorer backgrounds, ensuring that they get access to good health care. Also looking at all the different things that we can do to preempt any illness and disease. So we've set up programs that are around education around health. So I work with different organisations in the communities and schools as well around hopefully promoting health messages. And if there is a need where you see the sort of early intervention as well, do things around that. So it covers everything to do with health and things that people probably wouldn't necessarily think are related to health, but pretty much everything is. It's one of the things I've learned over the years is you can almost argue that everything is affected by health and affects health as well. It's the thing that I love to do, which is help people and seeing the results of those things as well. So whilst a lot of my role is quite strategic, so a lot of meetings and planning and setting things up, some of it isn't necessarily the hands-on, like sort of the coal face, as some people call it. But we do still have that element where I can get out to the communities and see people and interact with them, and actually seeing the improvements that we're able to make for them, and getting that feedback from them as well, to, you know, if they enjoy something, and seeing the positive element from it. An example would be one of the programs I'm working on is with Routes to Work. It's in employment, and we are delivering health improvement messages. So it's almost like teaching. And the young people that are coming on that are sitting and they're interacting really well, but then they're managing to use that information that we're giving them to enrich their lives, but also help them to progress into the world of employment as well, which then impacts on their mental health and their physical health. And then you can just see those improvements kind of going all over the place. So I love the fact that I can help people and we get to see the outcome of it and the fruits of our labour as well. Formal and community engagement side of things, where there's a lot of sort of meetings within the communities. So in North Lanarkshire, we have community boards, and we attend those meetings. That's our opportunity to engage with our partners in the council and third sector organisations, but also with community members, councillors as well, who sit on those meetings so that they can have a say in how their communities are going to work. But in addition to that, we've also got the organisations that sit within our localities. So I've got like health centres and health and wellbeing centres as well, that actually they run programmes and run, you know, cafes and things like that for the community to actually engage with and work through, and then we get to deliver those things out to them as well. In addition to that, we've got programmes and things that we get to run in partnership with our third sector organisations and the council and the likes of, and then that also lets us go along and see when things are running as well, and that gives us the opportunity to actually get that face-to-face engagement with people in the communities.